Welcome back, everyone. Today, we're going deep on irritable bowel syndrome.
IBS.
Yeah, IBS. Uh, you know, Abdominal pain, gas, and all that. And the bowel habits, gosh, they're so unpredictable with this, right? Really can mess with your life.
It can.
And it's not exactly rare, is it?
Not at all. It's estimated that 10 to 20% of people experience it at some point.
Wow, so many people. I bet a lot of our listeners are dealing with this or know someone who is. It must be so frustrating. You go to the doctor and
And they say nothing's wrong.
yeah, because the tests come back normal, but you're still feeling awful.
Right. That's because it's a functional disorder. The digestive system isn't working as it should, even though there's no visible damage.
Huh. Okay, so how do you even begin to treat something like that? I mean, it's not just a little inconvenience either.
Probably not.
Yeah.
We're talking about a real impact on your daily life, work, even your social life.
Hmm.
And mentally, it can be really tough too. Actually, the impact on quality of life from IBS can be even worse than things like asthma or migraines.
Wow, I had no idea. Okay, so clearly, this is a serious condition, and today we really want to dig into what's going on.
Yes. Unravel the mystery.
Exactly. What causes IBS? And what can people actually do about it? We want to give our listeners some real practical takeaways to, hopefully start feeling better.
Sounds good. And it's important to understand that IBS isn't just one thing. There are different subtypes.
Oh, okay. Like what?
Well, there's IBS with constipation, which we call IBS-C, and then there's IBS with diarrhea, or IBS-D.
Excellent.
And then, of course, there's mixed IBS, that's IBS-M, where folks experience both constipation and diarrhea.
Ah, so it's really a spectrum of symptoms, but I keep hearing this word multifactorial when it comes to the causes of IBS. What does that really mean for someone trying to figure out what's going on in their own body?
Multifactorial just means there are many factors that can contribute to developing IBS. There's not a single easy answer. It's like a puzzle. You have to look at all the pieces, diet, stress, gut bacteria, all of that to get the full picture.
Okay, that makes sense. So let's start piecing this puzzle together. And since we're talking about food, maybe we can start there. I think most people are aware of things like lactose intolerance, but what are some of the other ways food can be a trigger for IBS?
Well, for a lot of people, it's FODMPs that cause problems.
FODMPs.
Yeah. Fermentable oligosaccharides, disaccharides, monosaccharides, and polyols.
Oh, wow. That's a mouthful.
It is, haha. But basically, these are types of carbohydrates that aren't well absorbed in the small intestine. And when they reach the large intestine, they can cause a lot of gas and bloating, especially for people with IBS.
Ah, I see. So are we talking about things like, I don't know, broccoli and beans here, the usual suspects?
Those are definitely high in FODMPs,
Yeah.
but there are some lesser-known culprits too, like
Yeah.
onions, garlic, and even certain fruits like apples. Wheat can be a big one as well.
Wow. So it's not just about avoiding the obvious gassy foods. It's about understanding how different types of carbs can be fermented by gut bacteria. So how does that actually work? I mean, how do these carbs get turned into, well, gas, essentially?
Well, imagine your gut is like this bustling city, right?
Mm.
Filled with trillions of tiny residents.
The bacteria.
Exactly. And they're not just hanging out, they're working hard, helping us digest our food. But just like us, they produce waste, and that waste is gas. When FODMAs reach the large intestine undigested, they become a feast for these bacteria, and, well, let's just say the city gets a bit more fragrant.
Haha, that's a good analogy. So it's not just what we eat, it's about how it interacts with these trillions of bacteria in our gut. It's a whole ecosystem down there.
It is a very delicate ecosystem.
Right. And I'm guessing things like infections can really mess that up. I've heard that can be a trigger for IBS.
Oh, definitely. Studies have found that a significant number of IBS cases, something like 25 to 30%, actually develop after a person has gastroenteritis or even just, food poisoning.
Really? So even a temporary infection can have these long-term consequences, like the gut flora never quite recovers.
Not exactly. It's more about the inflammation.
Right.
See, when you have an infection, it triggers inflammation in the gut. And this inflammation can make the nerves in your digestive tract, well, they get more sensitive.
So it's like the infection sets off a chain reaction, right? And even after it's gone, the gut is still kind of on high alert.
Precisely.
Yeah.
And that brings us to another important piece of the IBS puzzle, the gut-brain connection.
Ah, yes. The gut-brain connection. I hear that phrase everywhere these days. But to be honest, I'm not sure I really understand it. Is it just that stress makes your stomach hurt? Or is there something more to it?
There's a lot more to it. It's not just a one-way street. You see, your gut has its own nervous system, millions of neurons. They control your digestion, all without any input from your brain.
Well, wait a minute. So our gut has its own brain. That's amazing. But if it's so independent, how come stress and emotions affect our digestion so much?
Because even though they're separate systems, they're constantly communicating, sending signals back and forth. And this is where things can get tricky with IBS. Research suggests that in people with IBS, this communication might be a bit overactive.
Overactive, so it's like a miscommunication.
In a way, yes.
Hmm.
The gut might be sending signals to the brain, but the brain is misinterpreting them, experiencing them as pain or discomfort.
So the gut's like, hey, something's not right. And the brain's like, oh no, we're in trouble.
Ah, that's a good way to put it.
But in reality, there's no real danger.
Right. But those misinterpretations lead to real symptoms. And stress just amplifies everything. When you're chronically stressed, it throws the whole gut-brain connection out of whack.
So we're talking about heightened sensitivity, miscommunication, and then you add stress to the mix. No wonder IBS can be so hard to manage.
It's definitely a complex interplay of factors.
Well, I'm definitely ready to hear about what we can do to break this cycle. Okay, so we've talked about the problem, but now I want to talk about solutions. What can people actually do to manage their IBS? I know it's complex, but where do we even start?
Well, a good place to start is with diet. Remember those FODMAPs we were talking about?
Yeah, those fermentable carbs, right?
Yeah. For a lot of people with IBS, reducing those high FODMAP foods can make a big difference. Less gas, less bloating, just feeling better overall.
So no more pasta for me.
Not necessarily. It doesn't have to be that extreme. You see, a low FODMAP diet is often used as a sort of elimination diet.
Ah,
You remove specific foods for a while and then slowly reintroduce them to see which ones are actually triggering your symptoms. It's about figuring out what your gut doesn't like.
so it's personalized, not just some generic IBS diet. That makes sense. But what about fiber? Isn't that supposed to be good for digestion?
It can be, but it's a bit tricky with IBS. Soluble fiber, like the kind you find in oats and psyllium husk, can be really helpful for regulating bowel movements, especially if you're dealing with diarrhea. But then you have insoluble fiber, the kind in wheat bran, and some veggies, and that can actually make things worse for some people.
Ah, so it's not all created equal.
Nope. You got to find the right type of fiber for you and pay attention to how your body reacts.
Listen to your gut, literally. Okay, so we've got FODMPs, we've got fiber. What about all the buzz around prebiotics and probiotics? Do those actually help with IBS?
They can, but it's important to understand that the gut microbiome is incredibly complex. Not all bacteria are created equal. Different strains can have very different effects.
Right, so it's not just about adding more good bacteria, it's about adding the right ones.
Exactly. Research is showing that certain strains like Bifidobacterium and Lactobacillus, those are showing some promise for IBS. They can help reduce gas, improve bowel function, and even, help modulate the immune response in your gut.
Wow, that's amazing. So how do we get more of these good guys in our gut?
Well, supplements are an option, but your diet plays a huge role too.
Yeah, like what kind of foods?
Eating a diverse range of fruits, vegetables, and fermented foods like yogurt or sauerkraut, they can really help. These foods provide prebiotics, which are basically fibers that those good bacteria love to feed on.
Ah, okay, so prebiotics are like food for the probiotics. It's all connected.
It is. It's all about creating a balanced ecosystem in your gut.
Right. Okay, so we've covered diet, but what about the other pieces of the puzzle? The gut-brain connection, stress, all that stuff. How do we address those aspects?
Well, that's where things like mind-body techniques can be really helpful.
Like meditation.
Exactly. Meditation, deep breathing exercises, even yoga. These practices can help calm your nervous system, reduce your stress levels, which in turn can help quiet that overactive gut-brain communication.
So it's about calming the mind to soothe the gut. Are there any specific techniques that are particularly helpful for IBS?
Mindfulness meditation has shown some really promising results. It's about becoming more aware of your thoughts, your feelings, your physical sensations without judgment. And that can really help break that cycle of stress and anxiety that often makes IBS symptoms worse.
It sounds like it's a way of learning to listen to your body without overreacting to every little sensation.
Right. And even something as simple as gentle exercise can make a big difference.
Exercise, even for IBS?
Oh, absolutely. Walking, swimming, yoga, anything that gets you moving can help regulate your bowel movements, reduce stress, and it's great for your overall gut health too.
Okay, so movement is medicine. You mentioned earlier that infections can trigger IBS. Is there anything people can do to prevent those in the first place?
Well, you can't completely eliminate the risk, but there are things you can do to support your immune system and your gut health.
Like what?
The basics, really. Wash your hands often. Cook your food properly. Avoid close contact with people who are sick. All those things can help.
Right, so basic hygiene, common sense stuff. But what if you're already dealing with IBS? Are there any treatments out there that can help heal the gut?
There are some promising therapies emerging. Have you heard of fecal microbiota transplantation?
Vehicle, what?
Fecal microbiota transplantation. It's basically taking healthy gut bacteria from a donor and transplanting it into the gut of someone who has an imbalance.
Oh, wow. That sounds kind of intense.
It's showing some good results for conditions like C. difficile infection, and researchers are looking into its potential for IBS too.
So it's like a total reboot for the gut microbiome. Are there any less, shall we say, invasive therapies out there?
There's some evidence that certain herbs and supplements can be helpful. Peppermint oil, for example, can help with abdominal pain because it
Yep.
has antispasmodic properties. And slippery elm can be really soothing for the digestive tract.
Peppermint oil, huh? I actually have some of that at home. What about aloe vera? I've heard that's good for inflammation.
Aloe vera can be helpful, but you have to be careful with long-term use. It can actually make constipation worse and even lead to dependence.
Oh, I didn't know that. Okay, so we've got diet modifications, probiotics, mind-body stuff, exercise, hygiene, even some pretty cutting-edge therapies. That's a lot to consider.
It is. And it's important to remember that what works for one person might not work for another. It's all about finding what works for you, your body, your IBS.
So where do you even start?
Start with what resonates with you most. Maybe it's cleaning up your diet or incorporating some relaxation techniques. Maybe you want to try a probiotic or start a gentle exercise routine. Just start small, make gradual changes.
No need to overhaul everything at once.
Exactly. And you don't have to go it alone. Working with a healthcare professional can be really helpful.
Oh, yeah, definitely.
They can help you figure out your triggers, recommend therapies, and just provide support and guidance along the way. And importantly, they can rule out other conditions that might be contributing to your symptoms.
That's a good point. It's about getting the right diagnosis and the right treatment plan. So as we wrap up this part of our deep dive, what are the most important things you want listeners to remember about managing IBS?
First, remember that you're not alone. Millions of people deal with IBS, and there are effective ways to manage it.
Right. You're not broken, it's a real condition, and there are solutions.
Yes. And second, IDS is a complex condition. It's not just one thing. So a holistic approach is really important. You have to look at diet, lifestyle, stress management, even the health of your gut microbiome. It's multifactorial, remember.
All those pieces of the puzzle? Okay, and?
And finally, remember that managing IBS is a journey. It's an ongoing process of learning about your body, making adjustments, and finding what works best for you.
It's about empowering yourself.
Exactly. With the right tools and the right support, you can regain control of your gut health and start living a fuller, more comfortable life.
It is encouraging to know there's so much we can do, even with something as complex as IBS. But I also think, it's important to acknowledge that it can be really tough emotionally.
Oh, yeah.
It can be frustrating, right? Like you're trying all these things.
And it feels like nothing's working.
Yeah, exactly. And IBS can be so unpredictable. Do you have any advice for people who are maybe feeling overwhelmed by it all?
It's understandable to feel overwhelmed. It's okay to feel frustrated. IBS can be a real roller coaster. I think the important thing is to be patient with yourself and to celebrate the small wins.
The small wins, yeah.
Even a slight improvement in symptoms can make a huge difference in your day-to-day life. You don't have to be perfect, just keep making progress, however small.
That's a good reminder. It's not an all or nothing thing. And you know what else? I think sometimes we forget that we don't have to go through this alone.
Absolutely.
Talking to a therapist or maybe joining a support group.
Yeah, those can be really helpful.
It's a way to connect with other people who get it, who understand what you're going through.
Right. Sometimes just knowing you're not alone can make all the difference.
It can. And on that note, I think it's important to talk about advocating for yourself, especially when it comes to healthcare.
Oh, for sure.
Because IBS is often misunderstood, right?
It is.
It's crucial to find a doctor who listens to you, who takes your symptoms seriously, and will work with you to find solutions.
Couldn't agree more. It's about having a healthcare provider who's on your team, who's a partner in your journey.
Exactly. And, going back to what you said earlier about knowledge being power, I think that applies here too.
Absolutely. The more you understand about IBS, the more empowered you'll be to manage it.
So keep learning, keep exploring, keep asking questions.
Exactly.
It's a journey, but it's a journey worth taking.
Well said. And remember, even small changes can make a big difference. What's one thing you can do today to support your gut health? To take a step towards feeling better?
That's a great question to leave our listeners with. Whether it's trying a new relaxation technique, experimenting with a low FODMAP recipe, or just taking a moment to breathe and connect with your body, every step counts.
It does. And with knowledge, self-care, and the right support, relief from IBS really is possible.
Thank you for joining us on this deep dive. We hope you learned something new and feel empowered to take control of your gut health and your well-being. We'll see you next time.